Consultant virologist at Cambridge University and naked scientist Dr. Chris Smith is with us now. Hi, Chris.
Hello, Kim.
Are face masks effective, and do you wear one on a plane?
No, save your money. Go and spend it on something useful instead that you enjoy doing, like having a beer. Those face masks are absolute rubbish and they do absolutely nothing.
So are you saying that viruses can get through face masks without any difficulty?
Depends on the face mask. The kinds of masks that we're talking about that you go and buy off a street vendor and then you wear on the underground or wear on the tram or something, wear around the streets, those are absolutely useless. If you are in hospital and you are fit tested for a proper prophylactic protective mask, those do work.
A comment on N95s, they need to be fitted properly, and all our workforces who are using those masks in the health care system and at the border have proper fit testing, because if they're not fitted properly, then they can be less effective than a normal cloth or indeed a surgical medical mask.
They form a proper seal around your face and around your nose and mouth, and you also wear eye protection.
The virus can be also infect you via your eyes.
And they have very stringent filtering as well. Unlike the ones that are cheap and nasty you buy on the street, where there are big gaps around the sides of your face, and every time you cough and sneeze, it just comes flying out the side. And also, they dampen. So as you breathe, they get damp, and that dampness just makes a nice conduit through for the virus particles. And the virus particles are absolutely minuscule compared to the enormous gaps in the fibres in the mask. For all those reasons, they're absolutely useless, and they make people feel better. And as I say, warn you off of hanging around with somebody who might be infectious at the time. But beyond that, they're just cosmetic.
Good to know. Thank you, Chris. Dr. Chris Smith.
Some of you may have heard the interview that Kim Hill did with virologist Chris Smith from Cambridge University. He was very clear on this. You can use a face mask if you like, but it is not really any protection.
WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick.
They have to be put on correctly. And often people are fiddling with their masks. They then have an opportunity to get the virus, whatever it might be, on their fingers and spread it in other ways.
And most over-the-counter options won't prevent people catching the virus.
They're not very effective. After all, the virus can be also infect you via your eyes. It basically likes to land on the mucous membranes and then from your eyes go down into your nose anyway. So I think people should not bother with face masks.
Let's talk about the masks. We hear about the N95, the N99, and people walking around with masks. Are masks, do they help prevent this? And what you see on the screen right now is a mask that most people have, the surgical mask, which is like paper, and then the N95, which is something I guess like a painter would use, and the N99, which has a filter. Talk about these masks. Do we get them or don't we?
Well, the coronavirus is a respiratory virus, and a surgical mask, let's start with that one, does not protect you from the from a respiratory virus. It's got leaks all around it, and it's really designed as a barrier protection for people in the operating room. That's why they call it a surgical mask. The N95, which is the one that people are buying up, important also to understand that that N95 mask, I have to be fit tested for it. I've got to make sure I've got a tight seal to wear it as a healthcare provider. The average person out there, the average citizen, that mask is not going to protect them. And as a matter of fact, in most cases, they're actually going to increase their risk of being contaminated with a virus when they're wearing that mask improperly, because they tend to touch their face, they tend to move it around. It's very uncomfortable. It's hard to breathe in. Not only are you not preventing yourself from getting a disease, you may be increasing your chance of getting a disease by wearing that mask. There are things you can do to keep yourself safe. Wearing a mask, if you're someone from the general public, is not one of them. important for folks to know that right now, their risk as American citizens remains low. There are things that people can do to stay safe. There are things they shouldn't be doing. And one of the things they shouldn't be doing, the general public, is going out and buying masks. It actually does not help. It's not been proven to be effective in preventing spread of coronavirus amongst the general public. And actually, people who tend to buy masks and don't know how to wear them properly, as a healthcare provider, I have to get fit tested. Folks who don't know how to wear them properly tend to touch their faces a lot and actually can increase the spread of coronavirus. You can increase your risk of getting it by wearing a mask if you are not a healthcare provider.
In terms of wearing a mask, our advice is clear that wearing a mask if you don't have an infection really reduces the risk, almost not at all. So we do not advise that.
Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask. Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
I see people wearing masks. Your views on masks, because a lot of people are going out, buying up their hand sanitizer, buying masks, and also toilet paper. But is there any reason why masks are something that people should be using?
So for the general public, if you don't have symptoms, there's no need to wear a mask. The thing is, the virus can still get in through your eyes. So if somebody's going to sneeze on you, the mask will only protect your nose. It won't protect your eyes. The people who will need to be wearing masks right now is if you are symptomatic, if you have symptoms, if you're sneezy, wear a mask, because we know that the particles that you sneeze out could possibly infect people. So what that does is keeps those particles inside your mask. You can't reinfect yourself. There are different types of masks. So the ones that people are buying at the supermarket are what are called surgical masks. They're the rectangular ones, and you'll see that they've got gaps in the back here. So they're not fully protecting you. The ones that our healthcare workers have are different, and they will have a full seal around their face. Those are very important for our healthcare workers, and we need to make sure that there are enough for them.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one. Mask alone can give you a false feeling of protection and can even be a source of infection when not used correctly.
Hi folks, I've asked the Deputy Chief Medical Officer, Dr. Jenny Harris, to come here to Downing Street. Tell us about the value of wearing face masks. You see face masks around the place. Is there any point to that?
If a healthcare professional hasn't advised you to wear a face mask, it's usually quite a bad idea. People tend to leave them on. They contaminate the face mask and then wipe it over something. So it's really not a good idea and doesn't help.
The average member of the public wandering down the street, this is really not a good idea. What tends to happen is people will have one mask. You can imagine they don't wear it all the time. They'll take it off when they get home. They'll put it down on a surface that they haven't cleaned, or they'll be out and they haven't washed their hands. They'll go and have a cup of coffee somewhere. They half hook it off. They'll wipe something over it, they'll put it back off, and in fact you can actually trap the virus in the mask and then start breathing in. So
they could be putting themselves more at risk by wearing a mask than not?
It just doesn't, so yes, because of this issue of, if you like, behavioural issues, which are really important when we're talking about infectious diseases, people can in fact adversely put themselves at more risk than less.
Healthy people are being warned against using face masks to protect themselves against the virus. As Justine Conway explains, experts fear incorrect use could lead to more infection.
It's becoming commonplace. On the streets and in supermarkets, people are increasingly wearing face masks, just as a precaution. The state government's advice on wearing face masks is in line with the World Health Organization. Under its guidelines, masks should only be worn if you have a cough, fever and difficulty breathing, or if you are healthy and taking care of someone with these symptoms, and or someone with a confirmed case of COVID-19. When you look at some of the masks people are wearing, you can see there is a huge range of products out there. And while they may offer some sense of security, experts warn if you wear a mask the wrong way, it could actually make you sick.
When I've been walking about, I've been seeing people touching the front of the masks, adjusting the masks on their face, and then going and touching other things. What we've got to remember is that front of the mask may be picking up different pathogens.
And the same goes for gloves.
But to your evidence point about face masks and wearing of face masks by the general public, this has been a controversial area in pandemic preparedness and planning for the 15 years that I've been involved in it. And indeed, I was on the phone this morning to a colleague in Hong Kong who's a professor there, who's done the evidence review for the World Health Organization on face masks. And we're of the same mind that there is no evidence that general wearing of face masks by the public who are well affects the spread of the disease in our society. Yes, it is true that we do see very large amounts of mask wearing, particularly in Southeast Asia. But we have always seen that for many decades, and it is entirely wired into some cultures that masks are worn quite frequently in open spaces. So it's very different, but in terms of the hard evidence and what the UK government recommends, we do not recommend face masks for general wearing by the public.
Healthy West Australians are being warned against using face masks to protect themselves against coronavirus. A safety video is going viral, showing how ineffective some can be as the nation struggles with a surgical mask shortage.
It's the safety video going viral. An Argentinian firefighter with a deodorant can, simulating a sneeze or cough. It's feared coronavirus could travel in the air, like deodorant does in aerosols. This demonstration showing most face masks are useless at trapping or blocking moisture, unless they're the N95 grade.
No pasa.
Yet across Perth, people are wearing them, some surgical, some homemade. The state government's advice in line with the World Health Organization. Unless you have symptoms of COVID-19, don't wear one.
To wear them as a perfectly fit and healthy person in the street is not going to provide you with any greater level of protection.
Unless thoroughly disinfected and cleaned, experts say homemade masks can even be dangerous.
They will soak up moisture very easily and can easily infect someone wearing them.
Patrick, anything to add on that?
Well, I don't think so. I mean, the evidence on face masks has always been quite variable, quite weak, quite difficult to know exactly, and there's no real trials on it. And we've undertaken a review. We'll give our advice to ministers, and they'll make decisions about what to do around that.
That if you're working in a hospital, in a care home, then there's a need for a mask. And so we've got to make sure that that is the top priority when the evidence around the use of masks by the general public, especially outdoors, is extremely weak.
The recommendation from SAGE is completely clear, which is that there is weak evidence of a small effect in which a face mask can prevent a source of infection going from somebody who is infected to the people around them.
The science has been very clear on this. For about 30 years, we've been testing the safety and efficacy of masks. There's a reason that we don't recommend masks for influenza, because they have been shown in the highest level, highest order of science is randomized controlled trials and multiple randomized controlled trials that we meta-analyze or we do a systemic review. So the highest level of science says that masks do not work to prevent the transmission of influenza. Now, there are no randomized controlled trials of SARS-CoV-2 at present, so there certainly are no meta-analysis. But the meta-analysis of influenza have clearly said we shouldn't mask the population because we know that there are risks associated with wearing a mask. Now, any medical intervention should be evaluated, and the individual should make a decision, do the benefits outweigh the risks? And in my opinion, as a medical physician, the risks are too high and there's too little benefit for masks to be recommended. Now, I will say there is a new study out there that just came out that is a more systemic review of the existing science as it relates to SARS-CoV-2. And that study by Jing Zhao, out of a specialist from Hong Kong, clearly says masks provided no benefit in this systemic review of the existing science. So when people say, and they'll often debate with me on social media, and they'll give me a long list of these studies that purport to say masks are effective. When you break down that science, you will find that they're using low-level science that is based on retrospective, observational, case controls, theoretical science, all of which is inferior to making a sound decision. So we look to the higher order, the more sound, reliable science, and that science clearly says masks are ineffective.
In light of evolving evidence, WHO advises that governments should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult, such as on public transport, in shops, or in other confined or crowded environments.
As of Monday, the 15th of June, face coverings will become mandatory on public transport. We'll make these rule changes under the National Rail Conditions of Travel and the Public Service Vehicle Regulations for buses. This will mean that you can be refused travel if you don't comply, and you could be fined. Transport operators will be able to refuse permission to travel where someone isn't using a face covering. And this weekend, I'm taking powers through the Public Health Act, leading to fines for non-compliance too.
We've therefore come to the decision that face coverings should be mandatory in shops and supermarkets. Last month, we made face coverings mandatory on public transport and in NHS settings. Under the new rules, people who do not wear a face covering will face a fine of up to £100 in line with the sanction on public transport. Should an individual without an exemption refuse to wear a face covering, a shop can refuse them entry and can call the police if people refuse to comply. The police have formal enforcement powers and can issue a fine.
First and foremost, masks and face coverings will, from 11:59 p.m. Wednesday night, be mandatory for everyone in Melbourne and Mitchell Shire.
Police are under investigation over the handling of a confrontation with a woman caught without a mask. Video shows an officer holding the woman by the throat after she resisted arrest.
Get off of me!
Grabbed around the neck by police, a woman who wasn't wearing a mask.
Choking me!
The forceful manoeuvre during a scuffle yesterday in Collingwood as her boyfriend watched.
It's a man on a girl and you choked her. For what? For a mask? For not having a mask? Look how pathetic you are.
176 people have been fined by Victoria Police in the past 24 hours for breaches of the state's coronavirus restrictions.
Another anti-masker who thinks it's his right to not wear one.
Where do you get the powers from? Well, you are. You've come up to me.
After minutes of refusing to cooperate,
We're going to place you under arrest until we can confirm who you are.
Yeah, I can tell you who I am.
Yeah, but we need to confirm it.
You don't have to hold me. You don't have to hold me. I will tell you.
in the past 24 hours, police have issued 176 fines. 51 of those were for people caught not wearing a face mask, and 55 people were fined for curfew breaches. A mother who refused to wear a mask and show identification was also arrested. The ordeal captured on camera.
It doesn't, as I say, make sense on the science. It doesn't make sense on the facts. And here's another absolutely fascinating fact. A few weeks ago, if you looked for papers, policy papers, research papers saying whether masks were a good idea, there were several announcements and papers, some of which have disappeared from their positions on the net, which were hostile to muzzles.
Yes.
And there was a statement by the World Health Organization, which was definitely against the wearing of muzzles. Now, a few weeks ago, the World Health Organization did a reverse ferret and changed its mind. And Deborah Cohen, of the medical correspondent Newsnight on the BBC, had an amazing scoop the other day. She actually discovered, and she put it to the WHO, that her contacts inside the World Health Organization had told her that the position of the WHO on muzzles had been changed because of political pressure, not because of medical reasons.
Wow.
The debate is deeply political. Newsnight understands that the World Health Organization committee that reviewed the evidence for the use of face coverings in public didn't back them. But after political lobbying, the WHO now recommends them.
Plan A, don't go in a crowd. Plan B, if you do, make sure you wear a mask. Right now, people should not be walking. There's no reason to be walking around with a mask.
Please, 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 wear a face covering when you go out in public.
Folks who don't know how to wear them properly tend to touch their faces a lot and actually can increase the spread of coronavirus. You can increase your risk of getting it by wearing a mask. There are things you can do to keep yourself safe. Wearing a mask, if you're someone from the general public, is not one of them.
We're joined by Otago University's public health professor Michael Baker Morena, and wow, I can't see you behind your mask. Hello.
Morena.
So how does it feel to be wearing a mask on public television?
I'm just getting a bit of practice in case I need one. But New Zealanders, as we know, we're just not used to wearing these things.
No.
But they're actually a great precaution to have available if we get a resurgence in New Zealand. And we think this should be part of our resurgence planning. and that every New Zealander should have a mask at home and know how to use it and when to use it. Virtually every country in the world now has masks as a key control measure, and we think every New Zealander could have one of these at home. In fact, why not get all the school children in New Zealand to start making these for themselves and their families?
After all, the virus can be also infect you via your eyes. So I think people should not bother with face masks.
On masks, why have you chosen not to mandate mask use,
At this
particularly
stage.
Auckland at this point?
Yeah.
And is it something that's still on the table? Could we still see mandated mask use?
Yes, we could still see mandated mask use.
But is there any reason why masks are something that people should be using?
So for the general public, if you don't have symptoms, there's no need to wear a mask. The thing is, the virus can still get in through your eyes.
I've got one right here in my pocket actually. This is a homemade mask, which there are various patterns for on the internet. I've also had a lovely one sent by a member of the public, which has got the TARDIS on it, which is nice. The important thing here is to, of course, hold the elastic at the ends and keep the hands away from the mouth and face. It goes here over the ears. You can use a face mask if you like, but it is not really any protection.
Cabinet has decided to move to mandating the wearing of face coverings on public transport for level 2 and above. These new orders will come into force from Monday. This isn't a decision we took lightly, but we know masks protect you and the people around you.
So the ones that people are buying at the supermarket are what are called surgical masks. They're the rectangular ones, and you'll see that they've got gaps in the back here, so they're not fully protecting you.
Let's just set partisanship aside. Let's end the politics and follow the science. Wearing a mask is not a political statement.
But after political lobbying,
It's a scientific recommendation.